Now, did you say that you were absolutely giddy about the CBO report?
Well, I think I did use that word. I'm very excited, I guess it would be the better word, about this, because when you're waiting with bated breath, trying to determine exactly what you will need to do to try to get to 216 on a bill like this, and all of a sudden you get this number, $130 billion in the first 10 years, $1.2 trillion over the next 10 years. That is music to my ears. It's exactly what we had hoped for, but I tell you, very few of us thought it would be this good.
So what do you think happened?
Well, I think what happened is that we did a lot of deliberating. I think that the president, when he sat down with the House and Senate leadership and he put in his fixtures, he always had in his mind there must be cost containment. We have got to contribute to deficit reduction. And on top of all that is the fact that we started out covering 31 million additional people, and CBO comes back and said, you do it this way, you will cover 32 million additional people, and you will make Medicare sovereign for the next 9 years. That is absolutely great news. You can't argue with that at all.
Well, you know what the Republicans are saying. I'm reading from the Committee on the Budget Republican Caucus. They're saying that you want to use Medicare as a piggy bank, over $500 billion in Medicare cuts to create a new entitlement.
What we're trying to do is make Medicare sovereign for our seniors going forward. And we do that by making tremendous adjustments in all of these provider pays, reimbursements for providers. We have seen all of the shows, I think you've done them, about the fraud in the system. We've seen a lot of TV magazines that are making people very, very upset with what's in the system. We are putting in place processes by which we'll squeeze all of that fraud and abuse out of the system. We won't be taking one dime out of the benefits of Medicare, only out of the provider side.
Does this CBO report close the deal for you to get to 216?
I think so. I really believe that the people who were very leery about what this would do to the country's debt and deficit are very pleased with this. It makes it easier. As well as on the progressive side, they wanted more people covered. And we'll be almost doubling the size of community health centers. And I'll say something else, Charlie. I think that people need to know that all they hear about this bill, we are paying for it, and it won't take effect until 4 years from now. There are a lot of things that will go into effect immediately upon the signing of this bill by the president. We will immediately be able to get rid of discriminating against children who are born with diabetes and other kind of pre-existing conditions. That will be immediate. We will immediately fund almost a doubling of community health centers. We will create this high-risk pool. That happens immediately, where people go into when they are a lot like not having automobile insurance, so you can be in there and get services. So there are a lot of things. I think, if my memory serves, there are about 13 reforms that take place immediately upon signing by the president.